too. So that's the problem they're going to get. They're going to see, have people who are offering products that aren't, either just aren't there and they're just taking their money, or if they do get something for it, it can be a product that's maybe been tainted. There's no quality control when it goes this way. So where that formula has been, what it is, how it's been diluted, nobody can tell you. And so it's just an completely unregulated product that would come across there if you get anything at all.
Sally, are you hearing from people that you work with and patients about, oh, I read this online, is this safe?
So there's all sorts of things online. What you can do, you could add water to your baby's formula, which would cause your baby to be so sick. We don't want people adding water to their formula in order to stretch out the supply they have at home. We have admitted babies to the hospital who've gotten quite sick when their families did coconut water and a protein powder, for example, thinking they were doing the best thing for their baby. That baby got quite dehydrated. So yeah, really beware of social media and special recipes to make something to substitute for infant formula. If you are inclined to try something, check in with your baby's healthcare provider first and see if there might be another option if we're, at a crisis moment for what to feed the baby.
You know, the media has been saying a lot. Check with your doctor, check with your doctor. Dr. Lauer, have your phones been ringing off the hook since February?
There really, we've seen a big increase in this over the past week, especially I think as the story has really hit the national media. It's just really now reaching the point where families are checking with us a lot. I think the point we want to make is that really nobody has a stockpile of formula right now. The normal places that we send people to, the WIC offices, they don't have formula. We don't keep formula. There's not formula that's, when they say check with us, it's not to get formula because we don't keep it. It's just what are the possible safe ways, alternative ways to feed babies if there is a problem.
And you mentioned diluting the formula, and I know Sally, she mentioned that too. If they're diluting it online and then you get it and dilute it further, what is the concerns there? I heard dehydration. What else? And have you had parents do that?
Yes. I mean, yes, over the many years we've had families do that if they couldn't afford the right amount of formula. So that's not a new thing happening for us. Scary when families are feeling pretty desperate and putting their babies at risk.
Dr. Lauer, what about cow's milk? Could that be an option?
Yes, I mean, we, normally we suggest introducing cow's milk, waiting until the baby's 12 months old to do that, with just some concerns in fairly rare cases of sensitivity to cow's milk that really young infants may not be able to tolerate as well. Now, in cases of the baby being over 6 months old, it's AAP suggestions, certainly not recommendations, but it's a suggestion as an alternative, is that at 6 months for a short-term coverage, if you're really in a tight situation, is that you could use cow's milk as a substitute, but then that comes with the same concerns about, is the baby able to handle it? Will their young intestinal system be able to manage the cow's milk protein? So watching, if that does happen, watching how your baby's managing it, how they're feeling, how they're acting, to make sure that they're tolerating it well.
Do you have parents trying to stretch it by maybe offering cereal early? I mean, what do you think about that?
Well, they can, and a lot of parents do that already. So that's not a new one. But again, it's just the younger the baby is, there's just always the worry of how well their whole physiology can manage things other than formula, or still, the best answer is breast milk. And I think this gets us back to additional encouragement for moms who are just now having babies or soon to have babies to really consider breastfeeding as the way to primarily feed their babies, that should not run into a shortage problem. So that's still going to remain the best ultimate way to be feeding babies. In the meantime, for these moms who are, for lots of very good reasons, using formula to feed their babies, we're going to have to be very careful about any alternative use, just because baby's physiology is quite different and won't handle this, many of these alternatives as well.
So you mentioned breast milk, which I think we all have heard is the gold standard for our infants, and that's a good segue into the Oklahoma Milk Bank and Becky. But Becky, I was one of those moms that it was hard. It didn't come naturally, and I needed a supplement. You have a milk bank. Tell us who makes the deposits and who are making the withdrawals at a milk bank.
That makes it sound like a financial bank, so thank you for that. But no, the nonprofit human milk banks in the United States and Canada, we actually recruit healthy breastfeeding mothers who have excess milk. And they go through a screening process very similar to if you're donating blood and you get asked, 1,000 questions. So they go through a pretty rigorous screening process. And then we take their milk that they've pumped at home or at work. We try to have drop-off sites around the state and in other states that we serve. So it makes it really easy for the moms to donate. And then that milk is going to be pooled with at least 3 different mothers' milk in a particular batch. And it goes through a specific pasteurization process. And then that's once it's deemed safe, it's dispensed to, a lot of the milk goes to hospitals for preterm babies in the NICU. And we do serve babies in the community that have, a medical need as well. So.
We used to have a milk bank here in the metro area, and I understand that it recently shuttered. How is that impacting you? And the other thing I want you to talk about a little bit, I'm sure that what you're describing costs a little bit of money. How do you pay for all of this? Do the recipients have to pay, or how does that work?
Yeah, so there is a fee, just as if you get blood products from the blood bank, there's a fee to we have to cover our operating cost. And since most of the milk is going to hospitals typically cover that cost. That's medical nutrition for their patients. And then the challenge is when we maybe have a need for a baby, in the home setting, in the community, we have here in Oklahoma have been working to get Medicaid coverage for those babies, which we will have later this year. So we're very, very excited to be able to serve even more babies that have a need in the community. I know in Kansas, y'all have legislation that Medicaid covers donor milk in the hospital setting, but not yet for babies in the community. So there would certainly be a gap there. And I'm sorry, I lost your other question in there, I think. So if I didn't answer.
No, that's fine. I think you covered it really well. Sally, you and Becky kind of go way back. You're not sure if Becky remembers you or not.
Absolutely.
But I have a question for you. Becky mentioned pasteurization.
Yeah.
And that sounds good. What about moms online who might say, oh, well, I'm going to help out and I'm just going to sell my milk, or maybe they're unscrupulous?
So I think that question is about informal milk sharing networks, and those are everywhere. There are lots of websites that talk about informal networks. Where moms who have extra milk will say, hey, I've got extra milk, and moms who need milk will go, okay, this is great. There are some things to be aware of or beware of. It's a little more complicated to be sure that donor is a healthy mom. It's a little bit harder to know if the milk is healthy milk. So there's a level of trust that has to happen between a donor and a recipient. I looked at one of those websites that serves as a way of linking donors to women who are looking for milk for their babies. And they talk about the 4 pillars of breast milk sharing, which means understanding the risk, which is you have a donor who's telling you that she's been screened, but you don't necessarily have proof of that. You have to ask that donors exclude themselves if they are not healthy, if they're taking medications or using substances that may cause the milk to not be the best for a baby to receive. You have to trust that the person collecting the milk is using safe, clean technique in collecting her milk, and then storing it in a safe way so it doesn't get contaminated. And then talking to moms who receive the milk about how to pasteurize the milk at home. And we know how to do that. This has been done for decades and decades in developing countries, talking to women about how to pasteurize their milk. You know, if you're on a wood fire, how long does your milk have to be heated? What do you watch for? You don't want to boil it. How long to reduce bacterial contamination? So it's out there. Women are doing this. There are ways to make it safer, but it is risky. I would say it is risky.
All right, well, Dr. Dana Hawkinson is in the house, and I have a question for him when it comes to breastfeeding, and that is, does COVID go through the breast milk? Do you know?
Antibodies do. I don't remember offhand about the virus itself. I know that we have no infections from breastfeeding at all. You know, we know that mothers can infect their children, but that's because of the closeness that they have when they're holding their babies, and it's still through those respiratory droplets. But I don't believe there's any viral transfer through the breast milk. It is safe. And again, you can have viremia, you can have virus in the blood, but that is a very transient or short-lived thing as well. So breastfeeding from that standpoint is safe, but being in close proximity to baby, that is how babies can get it. But again, breast milk does offer the ability to transfer those antibodies from mother to baby as well.
All right, thank you for that answer. We have a viewer question. Bob Hallinan is live in Studio B with us. Good morning, Bob.
Good morning. We do have, in fact, a couple of viewers are asking about goat's milk. They're wondering if goat's milk or almond or even oatmeal milk would be safe alternatives for infants.
All right, who wants to answer that? Sally?
We're all shaking our heads on the monitor, no. Goat's milk is missing a very critical vitamin B12. Almond and oatmeal milk would not have enough protein for the baby, so those alternative milks would not be recommended as a choice.
And I think we got a big thumbs up and concurrence from Dr. Lauer about that as well.
Yeah, and I would say the other thing to add about even cow's milk is to check with your child's primary care provider, because even cow's milk, there's questions about the right vitamins and iron, and they may need some supplementation of that, but the other ones really aren't going to provide the right mix of nutrients that a baby needs. They're perfectly fine later on in life, but problems as the sole source of food for a baby.
All right, Bob?
Yeah, we got another one for right now. Sandra in Parkville wants to ask Becky, does the breast milk you ship to Kansas City come from a local place or there in Oklahoma? And are the donations local or do they come from all over the country?
Oh, that's a great question. Yeah, most of the donors that we recruit are regional, so they're either here in Oklahoma, and certainly as we and have recently expanded to help serve the hospitals that the Kansas City Milk Bank was serving. That's a new goal we have, is to recruit more donors from Kansas and Missouri. So we know it's really important for the donor mother to know that the milk that she's donating is coming back to serve babies in her community. So we definitely respect that and really try to honor that. But as I said earlier too, the milk donations that we get in, we're going to combine milk from 3 to 5 different mothers, so we equalize, the nutritional composition as much as possible. But yes, it's regional for our bank. So,
Bob, do you have another one before we go to the COVID numbers?
Sure. What about almond milk mixed with protein powder?
Whoa.
They're getting creative, making the recipes. Dr. Lauer?
I'll say this is where we're really going to get worried about this, because as Sally has mentioned, there's a ton of stuff out there that mix this and that, and the formulas are really complicated mixtures trying to replicate as closely as they can breast milk. And the worry is that these simple, straightforward, a little bit of this, a little bit of that, just is not going to be able to replicate that. And we know that babies growth and development, especially their neural, their brain development, is critically reliant on getting the right nutrients into them at this early age. So these things that might meet most or some of the protein requirements are not going to meet all the requirements that a baby needs for proper growth and development. So beware of those ones, of those kinds of ad hoc mixtures. They can be dangerous.
Well, I know that they had to do something before there was before there was formula, and we're going to talk about that in a minute. But first, let's get a check on the COVID numbers. Once again, here is Dr. Hawkinson. What do we got this morning?
I mean, if you want some Arnold Schwarzenegger babies, maybe doing the protein powder with the milk might be good. Get them a little buff, get them ready for the pool and everything.
I think our pediatric people are saying stay in your lane, buddy.
Right, it's not safe. But.
Yeah.
So right now the numbers at the hospital, we have 6 active infections, 2 in the ICU, 0 on the ventilator, 7 in that recovery period. Still low overall. Again, we know some of the cases are increasing, hospitalizations are increasing. These are at very slow paces. And if we can hopefully follow behind what we've seen in the UK or South Africa, for instance, when they've had a surge, they haven't had those great surges of the hospitalizations of death that we have seen in the previous surges. So numbers are going up a little bit, but still very well in hand. No issues for capacity at this point. Hopefully we can keep it that way.
Dr. Hawkinson, a study finds that employers are relaxing vaccine mandates. What do you think about all that?
Yeah, I mean, I think initially when we had the vaccine rollout, those vaccine mandates, making sure you got your second dose. I think it does get difficult, and the waters are muddied a little bit with now a third dose and a fourth dose. We are also moving through time. Right now is quite different than the pre-vaccine era, so we do have a vast majority of adults who are fully vaccinated. They may not be up to date. We know that getting boosters has been difficult as well for a large amount of the population. They haven't had the uptake that we have. We've also had infection and reinfection, and so I think it really boils down to each individual employer to really make those assessments. It is a difficult question. Some employers, especially if you're public facing, it's probably better. You want your ability to keep your employees, keep them safe, and also keep the people that they're serving safe as well.
And what about booster shots lagging behind vaccinations?
Yep, that's exactly what I was talking about. It gets difficult. We've talked about COVID weariness with every aspect of it. So vaccines, I think, yes, getting those first 2 doses is extremely important. Getting that third dose is extremely important as well. But what we have seen is a lack of uptake of those additional boosters. Unfortunately, we know that there is good data to support the fact that those boosters will continue to reduce your risk of hospitalization, severe disease, and death. So the majority of the population needs to be getting those boosters, needs to be up to date, especially with that third dose. That is a critical dose to get to really develop that immune response, not only to that vaccine spike, but also to other variants as well. And so I think that's extremely important. We continue to endorse the fact of being up to date with vaccination because we know the benefits that being up to date provides, mostly reducing your risk as much as possible to hospitalization, severe disease, and death.
Just one more headline I want to talk to you about, and it's a really grim milestone that we reached this morning, or yesterday rather. Yeah. According to Johns Hopkins, we've had more than 1 million deaths from COVID. Mm-hmm. Flags at the White House will fly at half-staff all weekend to honor those who died. It's hard to believe that we are at this number. What are your thoughts around this?
I'm thankful for the interventions that we have now. We have those public health interventions. We know they work. They aren't there as much, and I'm talking about masking, distancing, trying to do things outdoors. We know those non-pharmaceutical public health interventions work. But now we also have vaccines, and it goes back to those first 2 questions about getting up to date and getting your boosters. We know that those things can help prevent disease. And now we also have those medications, especially those outpatient pills that you can take to help reduce your risk. What we've seen is that in the surge of January 2021, we know that deaths were much higher than they were in this last surge with Delta and Omicron. So that's good, and I think that is a consequence of individual vaccination. and then also infection and reinfection, but of course that is not as safe as the vaccination, protecting people from those more severe outcomes. We have the tools now to help reduce your chance individually, but also our chance as a country to reduce those hospitalizations and deaths. And the way through that is to continue to vaccinate, be up to date with the recommended vaccination schedule from the CDC about to do that. And by doing that, you are going to reduce your risk of death. The other thing is, if you have symptoms, test early so you can get on those oral antiviral pills. That is one more thing to help reduce your chance of going to the hospital and, of course, dying as well.
You know, I was reading that the 7-day rolling average is 300 now compared to 3,000, 300 a day compared to 3,000 in February. I mean, that's good news, right?
Yeah, we want to get that number down as far as we can. We know that there are still going to be some people who have comorbidities, have those risk factors for death. Your chance of dying is extremely reduced with vaccination and now these new therapies, but it doesn't mean it won't happen. But 300 a day compared to 3,000 is great. We want to get that number down as much as possible, and I think moving forward, and I believe moving forward, we will continue to be able to do that. But hopefully if there are surges in cases, whether that's locally or nationally, we can keep those hospitalizations and deaths down. We have the tools to do it now.
One last number that I saw today, and since we're talking about kids, 200,000 children have lost a parent or a caregiver to COVID. I mean, that breaks my heart.
Yeah, it affects families, it affects everybody. It has affected everybody, and I think we have understood that, and we just try to continue to move forward, looking to help those people. It's been a tragedy for the whole country, for the whole world, really, and hopefully those families are recovering from that, but it is difficult. And especially after vaccine, we know that the deaths are largely preventable, especially if you're talking about young people who have young kids. Being vaccinated, being up to date with vaccination, a lot of those could have been very preventable.
Yeah, thank you. I don't know if we have any reporters on the line today, but I always like to give them a chance to ask a question. Do we? We do not. All right, so if you're just joining us, we are talking about baby formula shortage and the fallout. Joining us this morning is Dr. Stephen Lauer, a pediatrician at the health system, Sally Page Gertz, a pediatric nurse practitioner, here in the studio with me, and Becky Mantle, the executive director of Oklahoma's Mother's Milk Bank. The Infant Nutrition Council of America has asked parents to not stockpile products while encouraging them at the same time to keep a 10-day to 2-week supply. That's tough. I got to tell you, as a mom, Sally, if I needed baby formula and it was sitting on the shelves, it would be hard for me not to take it.
Not to grab it.
Yeah, but I think the stores are now helping to do that. Let me ask you about this. Expired baby formula. Dr. Lauer, how safe?
Well,
You're welcome.
We were talking about this yesterday. The number one rule in this, and what we're really worried about, is that families are literally going to be stuck at 10 p.m. with nothing to feed their baby. And the number one rule is feed the baby. So we're in no way can we recommend it and say that's a good thing, but those expiration dates don't mean that formula goes bad on that date. That's the recommended use date. We try and avoid using expired formula or expired any medical product if at all possible. But we're very concerned that there are going to be families who actually get in that position. And if that does happen, be very careful, watch carefully, and try and find some current formula as quickly as you can. But those dates don't mean the formula goes bad that date, but you do have to be careful and wary of how intact is it after that expiration date.
Right. Becky, at the Milk Bank, I'm wondering, has demand gone up with the shortage of formula?
Yes, we've actually, throughout the pandemic, actually in the last couple of years, really seen the demand for donor milk going up across the country. In 2021, all of the U.S. milk banks dispensed about 20% more donor milk throughout the country. And we've certainly seen an increase just with the Abbott, shutdown and all. So we're certainly getting several calls a week from families asking about, the possibility of donor milk for their babies. And then, of course, I know you had asked or mentioned earlier about the Kansas City Milk Bank shutting down. So that was certainly a loss to all of us in the milk banking field, the first time that that's happened in our 37-year history of safe nonprofit milk banking. But that was a COVID casualty, and hospitals are stressed and strapped, and I think the hospital system, determined that there were other milk banks in the area that could serve the community. So that's what we've been trying to step up and do. But we need more donors. We absolutely need, breastfeeding moms in Kansas and Missouri to, contact our milk bank or, another milk bank and become a donor, so we can definitely meet the need as best.
And I assume that you'll walk them through that process if they give you a call.
Oh yes. They can go to our website, okmilkbank.org, and they can actually start the screening process online, or they can call the milk bank, and they'll start, with a series of questions. Absolutely, very, very easy to go through the screening process.
The breast milk market, I understand, is not regulated. Dr. Lauer, why not? And what's being done about that? It seems like that ought to be something that's regulated. No?
Well, I'll defer to Becky on that for the specifics. Okay. I'd say mostly that it's not because it hasn't needed to be, because it's been handled very well by the companies that are the organizations that have set this up and done it. They have done very good quality control, safety checks, making sure that this is a really high quality product. So it also has not been an area that's called out for excess or external regulation. But Becky, other comments from you?
Yeah, no, I appreciate that, Dr. Lauer. Now, in the 37, almost 38-year history of the nonprofit Human Milk Banking Association of North America, there has not been a single documented case of any adverse outcome of a baby receiving, safe donor milk from one of our milk banks. So we have a very rigorous screening process. We have every milk bank is assessed annually for safe practices. And we're told if we're not adhering to following the standards, we got to up our game. So very, very strict processes. And we actually are assessed by our local state health departments. And we are also working with the FDA to see, is there anything else that we need to be doing? So we are very close communication with the FDA on safe donor milk. So.
All right. And just real quickly, we know that breastfeeding is usually more cost effective, and there are biological barriers. Are there any financial barriers to breastfeeding?
That's an interesting question. I think of strolling through a baby store and the feeding section, and it looks like you have to spend $1 million to be a breastfeeding mother. And those of us who are lactation consultants and work with breastfeeding mothers say all you need to successfully breastfeed is a baby and one breast. You don't need a fancy bra, you don't need special shirts, you don't need a breast pump. We can teach you how to express your milk. You don't need all that stuff that people are marketing to women and make them think they need these things to be a successful breastfeeding mother.
All right. I know that our viewers always have better questions than we do, Bob. Are we hearing questions this morning?
Yeah, a couple of them, in fact, have been asking, and I'll ask these one at a time. Leanne wants to know, what's the difference between American and foreign formulas?
Yeah, Dr. Lauer.
The general one is that the formulas made in the European Union countries actually have what many people think are more rigorous standards put on them than American ones. So they're all, if they're from reputable companies, certainly from European companies, they should be perfectly safe.
Okay, then Isaac is wanting to know, is there any chance the FDA could issue an emergency use authorization for imported formulas like they did for the vaccines? What do we think of that?
Great idea.
I think I've not heard that's something that's actually being considered, but if it is, the that could happen. The hope is that these companies that Abbott and these others get revved up fairly quickly, and that they'll be back up to production levels and have formula back on the shelves in a fairly short amount of time. And whether or not it'd be worthwhile and able to get formula from another country over to us and have it on the shelves in a shorter amount of time was something that they just have to logistically see if that makes sense. But it's an interesting idea. Kind of a sad idea, frankly, that we would be discussing that in 2022 in America. But
Tim in Harrisonville read that some other people rely on formula for health reasons. Who else uses baby formula besides infants?
yeah, this is a great point, and we've been talking so far about the just routine normal formula for the vast majority of normal babies, but there's a subset of patients from infants to all ages of life who, for specific metabolic reasons, they have a problem that they can't digest or use certain kinds of foods, so they need very specific formulas. Those families, the advice right now is that they do need to be reaching out to the companies specifically who should be working with them to identify those sometimes almost individual needs for formula to get that for them. These are not the kinds of things that would just be sitting on the shelf normally in a regular grocery store. They're very specific formulas that are made for a very small set of patients.
All right, a couple more. Laura in Tonganoxie wants to know about infants who have food allergies. Any particular problems or precautions we need to take during this shortage for them?
Dr. Lauer?
Well, again, I think the worry that we have is that families are going to get into a situation where they're truly trying to figure out what can they feed do they have enough to give their baby tonight? So these are all the risks that go with alternatives to breast milk and to the standard formulas. So again, this is where we would recommend that you talk to your child's primary care provider, have those discussions about your child's specific needs and risks before making any of those changes to some other product.
All right, we have one more question. Joellen's asking, how is this affecting the underserved and minority populations?
We'll go to Sally here.
You know, like every other shortage of anything, minority populations are more affected than others. If you don't have access to transportation, if you have, less money, you're going to be more affected by this shortage. You can't afford to import formula from Europe for $245 for a 3-day supply. Inequity is definitely part of this.
Okay, are we good, Bob?
We are, thank you.
Okay, so nobody in the community asked this question, so I'm going to ask it. Sally, there wasn't always formula around.
No, there was not.
I mean, what did mothers do that couldn't breastfeed?
So I would be a prime example of one of those children. As a 70-year-old woman, my mother nursed me for a little bit. My grandmother's diary indicated I was a horrible baby, and my mother's nipples were bleeding and awful, and they fed me, as many babies in the 50s were fed, a Carnation evaporated milk formula, a can of Carnation evaporated milk with 18 ounces of water and a tablespoon of light Karo syrup. So babies in the 50s and 60s were fed those formulas, and that formula is being posted on the Facebook by lots of folks. It's like, and you'll find it in an old, a 60s, 50s era mothering book of how to make this this mixture for your babies. As an alternative, it's better than, almond milk and coconut water.
All right. Anybody, the rest of the panel? Becky, do you want to comment on that?
Well, I wanted to actually comment on the previous question about, how is this impacting some of our, disadvantaged communities. We already see lower breastfeeding rates in low income African American, Native American families. So they're more likely to be using formula. And what I think, hopefully, one lesson that we learn from this is that as a society, we need to and we can do a much better job of making breastfeeding easier for families, and especially those that are going to be, the most impacted in this current crisis. So it's very difficult for some families to think of breastfeeding as a realistic choice when the mother gets no paid maternity leave and goes back to work in 10 days. So that's just really, really difficult. And so those families now, here they are suffering the most because, we have not supported them. So they need access to quality breastfeeding care and support to meet their goals. That's one message I would like to,
I
share.
gotcha. Dr. Lauer, Sally looks pretty healthy to me, and she did self-admit she's in her 70s, but what do you think about carnation milk and Karo syrup?
Well, again, we'll go back to the number one rule is to safely feed your baby. So these kinds of, we are, again, really concerned that especially some of our underserved parents, those at risk to it, just generally are going to be stuck in this situation with there is nothing to feed their baby tonight. And in those cases, I think a discussion with your child's primary care provider about what are the safe alternatives. And I grew up on formula, I know that. So, there's probably had some of the same formula that Sally described. So there are safe ways to do it, but there are so many unsafe ways to do it out there right now. That's our biggest concern.
Right.
In what is hopefully a short-term problem that gets, cans back onto the shelves in a few weeks. But then again, down the line, hopefully we learn something from this and do a better job of addressing those concerns and support for new moms that Becky was referring to, so that this doesn't happen again.
Right. Safety is always the primary concern, especially with this program and this update, but we couldn't help the team when we were online looking and seeing all of the scams that are out there and reports of that. And so in an effort to stay in our lane, we invited a retired FBI agent, Rich Kolko, to join us. So we are live in Virginia. Rich, thank you, first of all, for being so patient and staying with us. I hope that this has been interesting for you to listen to. But what are your concerns? You've dealt with a lot of scams over the years.
Well, the scammers are out there, and they are the same people. What they do is they target a vulnerable portion of society. In reality, you're talking to a small group here. You're talking to families with young infants that need to get baby formula. So whether it's a tornado in Kansas and there's a shortage of generators, or a hurricane in Florida and people need the blue tarps, or in this case, parents that need a formula for their babies, the scammers swoop in, find that group, and use basically the same kind of scams for two purposes. They want your money and they want your personal information. And they have great ways of doing this. And when people are in crisis, as the doctor has said many times, most important thing is feed your baby. They're going to look for any outlet they can, so they could easily become vulnerable to some of these scams.
These bad actors, have you noticed any pattern, or have you looked into this or heard your colleagues talking about this? Tell me what you've learned. How do you spot it?
Absolutely. Well, the scammers use a very similar techniques no matter what the scam is. Again, their final goal is to get the money, get your personal information. They're going to go online. That's the international, bazaar of these days. And they can operate there with anonymity. But there are plenty of things that parents that are trying to find formula can do. You've talked about the difficulties finding it at the grocery stores or the military commissaries or anywhere else. So there's not a miracle pile of formula that's out there. So if a parent does find this online, they need to make sure it's from a reputable group. They can do some research on the contact. They can see photos. They can try and look for reviews, but don't forget, a lot of that stuff can be manipulated. It's fraudulent, it's fake. So you still have to be wary. The biggest thing I can say is, don't give your personal information more than you need to. Always use a credit card instead of using Venmo or another internet transfer of money, because you have no chance of getting that back. But at the end of the day, If it's too good to be true, it's not true, and parents need to be careful. And I've heard your group today. They've given some very good options, as far as taking care of the safety of your baby and making sure the baby's fed.
I think from my years back in doing the news that I had many a law enforcement officer tell me if it sounds too good to be true, it probably is. But the thought that occurs to me with this particular crisis is that as a mom, or a dad, you'll pay whatever it takes to feed your child. So would scammers be preying on that kind of mentality right now, or fear?
Of course, that's the easiest thing for them to go after right now. Who's in crisis? I used the tornado, the hurricane, the baby, a forest fire, whatever it is. Somebody's in crisis right now, and they're going to make decisions that may not be rationally thought out. In that feeling that I've got to get this formula for my baby. I'll do whatever it takes. I'll pay whatever I have to pay, and they find themselves being susceptible to these scams. That again, they see a picture, somebody promises immediate delivery, they show an expiration date, the brand new formula. They have a good reason or excuse of how they came across this. I found a store that was selling it, or and nobody had asked for it, and all of a sudden I have a great supply and I want to get rid of it quickly to you. So people will jump on that, anxious to solve the problem, and at the end of the day, they probably lose their money and they don't have any formula to show for it.
Well, what if I'm one of those people that lost my money? I pay all kinds, I get my formula, I find out it's not the real deal. How do I get my money back?
This is something I've told people forever. If you're going to do some internet purchasing, your best protection is to use a credit card, not a debit card, not Venmo. Some of the other money transfer apps have some potential to help protect your money, but really, once you send it, you're in trouble. So if you're going to do this, and I'm not saying they're all fraudulent, there certainly are ways to get this out there, safely and securely, but use a credit card. That way, if it doesn't come through, you can go back to your bank and protest that charge and potentially not lose your money.
And should they report it to anybody, and who should they report it to?
Absolutely. Law enforcement wants to know this. The FBI maintains an Internet Crime Complaint Center. You just go online there and file the complaint. You may not hear back from them right away, if at all, but what they're doing is they're gathering the intelligence on this. So if they get a report from Kansas, from Florida, from New York in this, and they find out it's the same people doing it, that helps law enforcement swoop in and try to put a stop to it. But as far as the individual cases being rescued or investigated and getting your money back, be careful. Same thing with those of us that are old enough in this crowd, and looking around the screen, a lot of us may remember guys in trucks in the back of gas stations that were selling furniture or TVs or some other product. If you come across something like that with the formula, you got to be careful. It could be that cut formula, fraudulent, fake, stolen. So you got to be careful.
All right. I hope it's nice in Virginia this morning, because I appreciate you coming to us. Is it nice out there today?
A little rainy, sitting on the lake though, so it's a nice morning. And thank you very much for having me in here today. And thank you, Mike.
Yeah. This is when we move into our final thoughts. So I'm going to let you have the final thought in terms of scamming. Any final piece of advice?
The anonymity of the internet is what's the biggest thing. People just get online and they forget they don't know who they're talking to. And in reality, this scammer of this formula, there's a darn good chance they're sitting over in Eastern Europe or somewhere in Asia, but they're using pictures that look legit. They're using names that sound okay. They may have even done their research on addresses. But look for misspellings, bad grammar. You can do reverse searches on the photos to see where they were taken. There's a lot of things you can do. While you've got some time, you can quickly Google how to protect yourself from internet scams. Lots of different agencies put out information, and not only talking about child formula here. That's a good skill to have, or good expertise to have for yourself throughout life, because the scammers are out there. They're getting worse. It's hundreds and hundreds of millions of dollars a year that are taken across the country, and the only person who's going to protect you is yourself. Protect your personal information and protect your identity.
Great advice and a good reminder. Thank you so much, Rich, for being with us this morning. Dr. Lauer, your final thoughts.
Well, this is hopefully a short-term problem that will get fixed as especially this one plant comes back online very soon. But in the short term, yeah, please be wary of anything that you're getting off of the internet and social media as ways to feed your baby. We'll be glad to talk with people about what we think are safe alternatives in this hopefully short interim, but be very careful with it because your baby's growth and development really needs to be fueled by proper food in these critical months. So just keep up to date with your child's primary care provider about the safest way to navigate through this.
All right. And Becky, would you like to give us the website one more time if people here that are listening this morning know somebody who could possibly donate breast milk?
Yes, absolutely. It's okmilkbank.org for the Oklahoma Mother's Milk Bank. And I would just add too that if you're breastfeeding and maybe using some formula, maybe contact a lactation consultant to see if you can, increase your milk supply. And if you do have a baby with severe formula intolerance and you're really panicking, absolutely call our milk bank or another, nearby milk bank, and we will work with you. So.
All right, that sounds good. Sally, your final thoughts today. And you look very healthy, by the way.
Thanks. Feeling healthy. I think this shortage is illustrative of lots of bigger issues in the United States in terms of policy. Also, policy in terms of supporting families, the need for paid maternity leave. We are the only country of the industrialized nations that does not have paid maternity leave for women and their partners in taking care of their babies, which makes it a little easier to have exclusive breastfeeding if you've got good maternity leave policy. I do want to highlight that KU Hospital has a warm line if mothers have questions about breastfeeding that they can call, which is 913-588-5640, and that will connect you with one of our mother-baby nurses and lactation specialists to help you with your questions. Can talk to you about how to increase your milk supply if you're currently breastfeeding and wanting to not need supplement for your baby.
Could you say that number one more time? And I know the web folks will drop that into the chat.
So the warm line, 913-588-5640.
All right, thank you. And Dr. Hawkinson.
Yeah, I mean, it's definitely a problem. We heard some questions about different milks, including goat's milk. I just encourage everybody to understand that, using these natural milks from animals, cows, goats, anything like that, make sure those products are pasteurized if you're drinking those in your house. We know the diseases that can spread from unpasteurized milk. The other issue is, unfortunately, we've passed the milestone of 1 million deaths, but we now know and have the tools to continue to prevent those and reduce your risk individually and those of your loved ones significantly. Get vaccinated, be up to date with your vaccines. If you are having symptoms, get tested early, get on those outpatient therapies such as Paxlovid. And of course, if you have concerns about going into any situations where you may have exposure, you can avoid those and you can always wear a mask. So.
All right, great advice. Thank you to all of our panelists for being with us today, and especially thank you for putting up with me. I'm the backup to the backup to the backup. Jess is going to be back on Monday. Don't forget, you can catch our updates anytime by logging on to Facebook, YouTube, and Twitter. Go out and make it a great weekend. We will see you back here on Monday.
Coming up Monday on the Morning Medical Update. You drink it for health reasons, but that diet soda is causing everything from liver issues to stopping your medication from working. What's inside those drinks causing all the woes? We'll see you Monday at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.